So the neck is the fourth potential cause of symptoms. Every time you get a concussion, you also get a whiplash injury. Whiplash and concussion have the exact same symptoms. So the symptom profile of neck dysfunction, neck injury is the exact same as it is for concussion. So headaches, dizziness, nauseousness, concentration difficulties, visual abnormalities. Your visual system is actually intricately linked with your neck. And so when your eyes move, your neck muscles will fire and engage. And if there's some sort of dysfunction there, that might create headaches. Well, for the person who is an ocular motor therapist or a vision therapist, they're going to say, well, when your eyes move, it causes a headache. Well, you have a visual problem. Not necessarily. It might be a neck problem that's referring pain to your head, because every time your eyes move, certain muscles in your neck are engaging, and if there's dysfunction, that creates a referral pattern up to your head, and now you have a cervicogenic headache that's implicated or started or initiated from your ocular motor function.